Senator Tobiasen, you are a business coach and you work with clients who include healthcare professionals. One of the things that you're working on here is trying to make the business of healthcare better for them so that we can attract and retain more of those workers. You've got a tax rebate for medical school loans. You've got a moratorium on income tax for some of those workers. But you're also looking to increase the amount doctors and others make when they get reimbursed by Medicaid. Why is that important?
It's important because we've created an environment in New Mexico now where it's very difficult, especially for private practice doctors, to make a living. And if they can't make a living, if they can't see a better way here, they're going to exit. And they actually have been exiting in mass numbers. I have a personal experience in that, one, coaching and helping them navigate through doing business as a doctor in our state for years here with my coaching firm. But then my husband in 2017 almost passed away right here in our state because we didn't have the specialists who could help him. So thankfully I was able to fly him to Cleveland Clinic where they saved his life. But now in 2025, we're in an even worse situation with access to medicine. So we have to start attracting and retaining doctors or our situation here will continue to erode.
And you know, this is a story that we sometimes hear, but not usually for people who live in Albuquerque like you do. So the healthcare worker shortage we think of often as a rural issue, but it's both urban and rural.
It is urban and rural. It is in every corner of the state. And right here, where almost half of our population lives, we are in a crisis. So if we're in a crisis in Albuquerque Metro, we are in a massive crisis in our small towns across this state. And we owe it to the citizens of New Mexico to fix this problem now in this session.
Thank you so much for talking with us today.
Thank you.
Representative Anaya, 32 out of 33 counties in New Mexico have a critical chronic shortage of primary care, mental health, and dental providers. You're proposing that the state spend $2 million on recruitment. Who are you targeting?
I am very excited to talk about this. So what our program would do is essentially recruit back New Mexico graduates who have graduated from our institutions who are currently working in other states. One of the reasons why is because we are competing with the rest of the nation. Right now, New Mexico is not special in that we are desperately lacking healthcare workers. So, as I say in show business, you gotta have a gimmick. So, I really hope that this program in particular can call back graduates of our institutions to come serve at the place that they love the most, which is here. One of the things that I've found, however, is that a lot of the recruitment incentive programs are in several different departments. And so it leads to a lack of communication. So this hopes to bridge that. The way the program works is it uses alumni data from our own institutions to call our alum and essentially headhunt them and say, hey, we know you're finishing up your fellowship. We know you're finishing up your residency somewhere else. We know you're working somewhere else. Here are all the incentive programs that we have passed throughout the years to make sure that you're able to come home. So whether that means it is our loan forgiveness programs, whether it means it is our child care programs, all of those exist in different departments right now. So one of the jobs would be to lay that information out to make sure that they understand all of the benefits that they could have when they're coming back home. But not only that, we've also found that licensing and credentialing is a tricky process to navigate, and it could be held up. And so essentially what this program does then is walk those who are interested in applying for open jobs here through the licensing credentialing process, if in fact they need to be licensed or credentialed, and essentially holds their hand until they get back home. So we connect them with community resources, we help their partners find jobs, we help them find housing here, we hook them up with our child care incentives, and hopefully once they make a life here, their students can use a lot of the programs that we have for higher education right now that we've passed in years previous.
Representative Anaya, thank you so much for talking with us.
Of course, anytime.
Fred Nathan, your think tank, Think New Mexico, made the healthcare worker shortage your main focus this year. What, in all of your research that you did in putting this package of proposals together, what do you think the root of our healthcare worker shortage is?
It's a number of policies that we've implemented over the years. This has to do with low Medicaid reimbursement rates, a medical malpractice system that's completely lopsided, and tax policy, which puts tax. We're one of only 2 states that taxes medical services. And what your viewers may not know is that those taxes are eaten by the doctor. They can't pass them on to their patients. Medicaid and Medicare won't pay state taxes. Insurance companies, if you're privately insured, negotiate it out of the contract. So doctors, for example, in New Mexico are paying 7% that they wouldn't be paying in any other state except for Hawaii.
So we just talked to Republican Senator Tobiasen about some of her proposals, but you have some different approaches. What are you looking to do?
So, for example, on the low Medicaid reimbursement rates, we want to create a healthcare permanent fund. And as your viewers may know, there's about a dozen of these, but none for healthcare, even though it's the second highest expense to state government and also the fastest growing. So we're going to try to do things like revert money for capital outlay projects that were not shovel ready. And the bill's going to start at Senate Bill 88 with $300 million from this year's one-time monies. And we're going to try to build that to $2 billion. At that point, it would be like a college endowment. And we'd take 5%, so that would be $100 million, and then take it to the feds and get it matched 3-to-1 to use for Medicaid. Now you'd have $400 million every year that could be dedicated to bringing up our very low Medicaid rates. Doctors tell us they're losing money on every procedure that they do for Medicaid patients. So that's one way to keep and attract new doctors, is to bring up those rates. So that's another example.
Mm-hmm. And medical malpractice is a big issue. What's your view on how to fix it?
Well, it's not surprising that we're second in the country with the number of medical malpractice lawsuits filed, because we have no caps on attorney's fees, no caps on punitive damages, and the lowest standard for proving punitive damages. So we want to rebalance the system, make it more patient-centered and safety-centered rather than lawyer-centered. So one example is on punitive damages, to take 75% of those punitive damages that are recovered and put it in a public safety fund to help hospitals, particularly rural hospitals, reducing staffing ratios, enhancing training, and helping them to get equipment, just more modern equipment, and that'll bring down the number of incidents of medical malpractice.
Punitive damages are designed to punish people who did wrong and deter other folks from doing the wrong thing. So you're not proposing to reduce or put a cap on those punitive damages, but instead to funnel that money into the system in a different way.
That's correct. We don't see any reason that we need to shower hundreds of millions of dollars, like in the New Male Medical case, on attorneys. That money would be better used, kept in the system to reduce the number of incidents of malpractice.
Another thing you're working on is making it easier for doctors to get licensed in this state. How does that work?
There's an interstate compact which allows doctors licensed in other states to practice here. It's the single most important and impactful thing this legislature can do this session to reduce the medical shortage. And I'd also point out we're also trying to pass 8 other compacts for physician assistants, EMTs, almost every category of healthcare workers. We're below national standards by a material amount, and these compacts would help to address that problem.